Good evening, Dr. Ankit. So today we are here, and first of all, congratulations for passing MRCS Part B OSCE exam in January Hyderabad diet this year. And hopefully we are here to listen live your success story, how you crafted your preparation, and overall your journey, what are your materials, and like all other things. Hopefully we will be focused on your MRCS OSCE journey tonight, and we will not take that much time. So we will have in short, and if we have any questions from the audience, then hopefully we will have the answers from you. So we are happy to have you with us. And good evening again. So first of all, uh, how long did you take your preparation for MRCS OSCE, and how did you start your journey?
Yeah, I think I passed my, first of all, good evening, everyone. My name is Dr. Ankit, and I passed my MRCS England in this January, Hyderabad. And I think I started my this preparation, I think 8 months back, 6 to 8 months before January. And I passed my MRCS part in May, and actually I started in August, to be exact. I started in August. Actually, preparation I started after mid of August. And initially, I was fighting to find the correct content, from where to read, how to read. Then I saw some other people messages on some other groups, and I found one fun doctor in Abu Dhabi who just cracked MRCS. So I asked him from where to read. Then she told me about this excellence for MRCS from Dr. Hasnat and Rifat. Then I joined that. Then I found actually the correct content, not even the correct and the concise content, from where to read actually. And so that I have not to go run here and there. What is the content? What is the correct content? So I was actually very confident after reading the content from the excellence for MRCS. And definitely the mock sessions also helped. But yeah, ultimately you have to read yourself also. And just by cramping will not solve the problem. You have to understand the concept, then only you can answer. Otherwise you will mix up with the students. They only mix up a lot of things. But if you know the concept, then you can answer any question. There's no problem in that.
So
Right.
you got to know about excellence from one of your friends, right? So you have met
Yeah.
one, and is he or she from India as well?
I don't know. Just we talked on Telegram, but she is
Sure.
working in Abu Dhabi. I'm working in
Okay.
Dubai. She was working in Abu Dhabi.
Okay, all right. So you me and Dr. Rifat Bhai both have noticed that you are also a regular participants in both classes and mocks, right? And you are
Yeah.
busy schedule, and though like we have waited some other stations, and you have said that Doctor 5 minutes like this way, and that
I
must
tried my best out of my
yes,
schedule
yes,
what
yes.
to do.
Obviously, you have shown your dedication to pass the MRCS OSCE, yes, and so just tell me or tell us that how did you craft your preparation in short? Like if someone is a beginner, okay, so how one can just start the preparation regarding MRCS OSCE exam? Because this is actually like in our part A exam, we give the MCQ exam, right? Right. We just have to
Yes,
face the computer and no one else is there. But here we have to face the patient, we have to face the doctors, examiners, and we have to keep our nerves strong, right? So this is
yeah.
new dimension actually. We have
Actually.
the junior doctors are not actually well oriented or well oriented giving this or attending this type of exams. So how did you just fix those, and just tell us first these things, and then we'll come to the next topic.
In the starting, I think the person should concentrate on the concept, like in applied science and pathology. Once they're strong, then they can start having mocks with their friends or online mocks with with any friends or anyone. And in skills part, I will say just read the whole data once or two times. What is inside that and what you have to do actually, and then I think you should start doing the mocks. At least 5 to 6 times you have to do every topic with your friend or with anyone. At
Yes.
least 5 to 6 times.
That's
Otherwise, you can't perform an exam.
okay.
It's
Okay.
almost impossible.
That's a great
So
point.
this is why.
And you are actually one of the participants of last July to 2024 December batch, right? So
Yes.
that batch actually you are almost a regular, but how did actually we could help to achieve you this journey? So could you please just share the advantages that you got from the excellence and the disadvantages or the flaws, if we have, you can share, please.
No, the biggest advantage was the content which was shared on the drive. That was because I was doing job in Dubai also, so it was very difficult for me to attend the live classes. But definitely, I saw all the lectures. I saw all uploaded lectures. I saw each and every one, every minute I saw. I was seeing offline, but I saw all the lectures. From there, I got the concept, what is happening, why it is happening, and that's why I was able to answer in the exam. And similarly for skills part, yeah, mocks are the most important skills part. If you do the mocks, definitely, and this is where like the content, what questions they're gonna ask us, so we know already before that. So but just we have to practice on the questions. When no new questions was asked, I think for me maybe 10 questions maximum were
Okay,
asked
okay.
outside that.
That's appreciating. And to be fluent and to be confident in the MRCS OSCE,
Yeah,
just attending in the mocks and just open your mouth. That is the most important key things. And apart from starting with your reading partner, what are the other keys that helped you to achieve the success? Anything else?
I will I will say only mocks helped me.
Okay,
I
okay,
did a lot of mocks. My
okay,
friend
all right.
was there with me, who was also preparing. So we
Oh,
did mocks
okay.
together
So,
by too much.
okay, so you are in the course and you shared about the study materials, those were enriched and those uploaded in the Google Drive were almost complete. So what about the classes of Excellence for MRCS? Those classes were actually lengthy, almost 4 hours, 5 hours, like, yeah, you have already attended. So how did you manage those 4 or 5 hours despite of having a job?
Okay, if you are diligent that I have to do this, then you have to take out time. This
Yes.
is the only. If you don't want, if you want, you are reluctant. Okay, I will do it. I will not do it. If you want to do it, you have to find out the time. Then I keep on running from my work and I just sit in the one room, close myself from my kids so that I can attend the class. You have to give some like you have to do it. That's the only way to get the time. Everyone has 24 hours.
Yes, yes, yes. That is a good point. So, what could be your messages, those who are planning to have excellence, MRCS OSCE exam, and those who are planning to be with excellence for MRCS, what could be your message to the future
I would
aspirants?
like to say, don't read much. Reading the content may you are reading maybe 75% still enough. May more important is how you can say there. If you can't say there, 100% is also zero. The point is that read 80% is also fine. Most important is you can deliver there or not. So do a lot of mocks. Every day do mocks. Every day 2, 3 mocks you keep on doing. That is the only way to success. This is what I feel. I
Okay,
don't know about
okay, okay,
much, but this is what I feel.
okay. So we have another mentor, Dr. Rifat Bhaiya. Can you hear me? Hello.
Yes, Dr.
Yes,
Hasnat. Yes,
yes, yes,
Dr.
yes.
Hasnat and Dr. Ankit. Nice to meet
Yeah,
you, brother. So
yeah,
first time, just we are in the face to face.
maybe.
Previously we talked over the phone in the Telegram, but after passing the MRCS
uh,
OSCE is the first time we talked. Okay, so it's a very fortunate and great news for us that you have passed the MRCS OSCE, and definitely Um, we one thing I would like to say, like we do help most of the candidates, like so many candidates, but all the candidates are not passing the exam. So the result who has passed the exam, this is also our result, and who are not passing the exam, that is also our result, right? So, but
yes,
Alhamdulillah, I can say that most of the candidates who are passing and who are sticking with our course and who are following the rules that we used to give and we used to uh, s- uh, uh, like we say before starting, especially I do say before starting every single classes, like whenever take the skill portion, like in the ASSC, I do brief personally what we'll have to do, what are the key points you'll have to focus in your mind, you'll have to keep in your mind every single time. But like one thing I would like to know from you, like we have started almost 1 year back, and we do have so many foreign candidates as well as Deshi candidates from Bangladesh. But you work in Dubai, right? You work in Dubai
Yeah.
and you are from India. So how you become so confident, and how do you why you come to us? Because there are so many famous courses over the field, and those are very famous. Especially, I do appreciate they are running the courses for a long period of time, but uh, these are the expensive courses. Like still, our courses are much more lower than the rest of the courses, but still it's a high amount because we do give some huge effort, like more than 80 classes and so many mock sessions, as well as we do stick with the part B courses every single time. So why do you rely us? Because there are other courses in the field. So why didn't you go to the so-called courses, the famous courses, but you come to us? You just tell me the answer.
Good question.
This is a very difficult question to answer. I actually am telling, I just talked to that girl who was working in Abu Dhabi. She was so confident with this group and this subscription. Like I also feel confident that yeah, I will also be able to do this. And then I also saw your YouTube page free. Like on YouTube, there are few free lectures are there. So I saw those lectures, and I feel that those lectures are very convincing to me. So I thought, yeah, this will be a great way to go ahead, and I feel comfortable with such
Okay,
kind
so
of teaching.
okay, thank you, thank you. So Dr. Hassan already mentioned that before starting the HSCA classes, most of the time, whenever I will just thinking to give the post the link in the group, and you were just saying, Doctor, would you please send the link 10 minutes later or 15 minutes later? Is it possible to
What
postpone
to
the
do?
class for 30 minutes? So there are so many
What to do?
candidates,
Because I was
but
so eager to attend
especially
mocks, but I because of my timing, the timing in Dubai is like 5 and till 9 I am working. So I have to adjust my timings also. Sometimes I'm requesting them, please complete by 8 o'clock so that I can go attend. But it was sometimes I am fortunate to attend the mocks. Sometimes I'm not fortunate to attend the mocks. But I'm trying my hard. That's what I can say.
okay. So one thing I just will say previously, that if anyone want anything from the core, and it is really possible to manage by at any means. And
Yeah, of course.
really, I really do appreciate that you said that. And I am also, I always like to say in the candidates who are with us, like personally, most of the candidates are my ex-students for from the FCPS or residency or some other else from some other else. But most of the candidates are saying, Bhaiya, like I ask them, why aren't you attending the classes? When are you going to attending the exam? Why aren't you participating in the mock session? Like they always do say, Bhaiya, I do have hectic duties, I do have some familial issues, everything that is considerable. But if you want to pass in the exam, then you'll have to consider that you'll have to attend in the live interview classes and live in the mock session like Dr. Ankit has done previously. And really, really, I do appreciate it. Okay, one thing I would like to say on my next question from my side. So you already said that you uh, from my experience, and as we are mentoring so many of the candidates in the MRCS OSCE field, so for the last 1 year, almost 135 candidates, and from my experience, I learned to know that passing in the Indian centers are really, really, really difficult. So whoever asks me, I'd like to, Doctor, I'd like to sit in the India center. So I, from my side, I always do discourage them to pass to sit in the India centers. But you passed in the very first attempt. So definitely it's a big congratulations for you. Now tell me, uh, did you take the support from only us, or you take the support from some other else along with us, or is excellence emerges OSCE is enough to make anyone pass in this difficult field?
Actually, you were having one live session course, but that was in Bangladesh, so I can't travel there because visa and all those things. So one
Yes,
live
yes, yes.
session was going on in Dubai only, so I took that.
Mhm.
That Dr. Salah live session was there, live
Okay.
demonstration, like
There was
like
a
procedure.
hands-on course. Yes,
Yeah, the
yes,
hands-on
hands-on
course. The
course.
procedure has to be done by yourself in front of someone. So
Yes,
I
yes, yes.
do took that course because it was in Dubai only, so no traveling for me. So I took it from
Yes,
there.
yes.
That's the only thing
You
extra I
talked
did.
you talked with me. Even myself and Dr. Hassan also did the course. Okay, no problem. So basically, we do conduct the hands-on course, and I don't know whether you know that or not.
Yeah, I know,
Foreign
I know.
candidates, many of the foreign candidates are trying to come in Bangladesh, and on that time there is some our country condition was unrest, and there are some visa issues, and nobody couldn't come to in our
Yeah.
country. But from one army person from Bahrain, he an Indian from India. He came over in our country and he attended in the session,
Oh, nice,
and he
nice, nice.
uh, yes, and they are contacting with us to come over Bangladesh and join in the simulation course subsequently. Okay, that's great, Dr. Ankit. So
Yeah.
now tell me, before the exam, just 1.5 months back, you all the course classes have been done. Like, how did you manage the rest of the 1.5 months before, and whatever your final preparation before the exam?
Final
How do
preparation,
you
I'm telling
manage?
manage. I was doing my job, and whatever time I was getting apart from my job, I was doing mocks. They those people who have passed. My seniors was there who passed exam like 4 3 4 years back. Everyone was like saying that there is the only solution to pass the exam is doing mocks. In applied sense, the skills doesn't matter. With whom you are doing doesn't matter. Just keep on doing mocks. Otherwise, you will not remember anything in the exam.
Yes, yes, Dr.
Mocks,
Ankit is emphasizing on that, and this should be the advice to our candidates that who are not attending
yeah,
forms.
mocks is the key to
It's
success. This is
very
what I feel.
vital.
I don't know much, but what I know from
And
my
always I do give the advice to our candidates. If you don't, even if you don't participate in the live interactive classes, that is okay. I'm considering this thing. Just do this thing in the offline. That is also considerable. But you will have to attend in the live interactive mock session, and every
yeah,
single time,
mock,
because we'll give you a station from our side. We will give you a certain station, and we will ask you random questions. So, and definitely that will be a real exam condition, so that will
yes,
make you perfect, and it's a huge opportunity to practice in an exam condition. That, and definitely,
exactly.
because I have seen many candidates. I have seen many candidates. They are saying, "Bhaiya, I do not know the answer," and you discussed in that class. But whenever I enter into the exam hall, my professor asked me the question, but I couldn't answer. I know the answer, but somehow couldn't speak up the answer. I couldn't say about the anything about the question. So definitely that is happening only because of they are not attending the mock session. They didn't participate in the mock session, and mock session is the key to success, I think, for the MRCS of the field.
There was an
Yes,
interesting
100%.
Okay.
story that I didn't remember the topic, but there was 8 station in one of the mock sessions, and I was supposed to give the third station to Dr. Ankit, and Dr. Ankit was also supposed to participate in the third station, but somehow we missed. Then I gave the third station to someone. Then I waited for Dr. Ankit for the fourth station. Then he left again. And then Dr. Ankit texted in the Zoom meeting box that he wants to participate in the next meeting, next station, that is the sixth station. Then he also left again. Somehow he got to manage on the eighth, but before that, I had to wait for Dr. Ankit for every station. And
I what to do? I have two kids. I have two small kids. I have to manage them also. I have to manage everything. So, but yeah, whatever ends best is the best.
yes,
That's what I say.
that was the level of dedication from you to, and that was the commitment of yourself to our to
Yeah,
excel.
And that is really, really appreciable and appreciable. And he was really desperate for attending the mock session, and
Yeah,
Dr.
because
Hassan
all
and
my
I
seniors
do
told,
notice. Yes.
without mocks you will not pass 100%. If you don't give mocks at least
Uh,
every topic five times, you will not pass. Okay, my all seniors who are in UK right now, they told like this: you will not pass exam 100%. So that's why I was giving mocks to you, to my friends. My friend was there, Dr. Hari. He's also in your group. I hope
Yes,
I
yes,
had
yes.
recommended
yes,
to
in
him.
our course.
Yeah, he's my close friend, and he also works in Dubai. So we are together here working
Yes, yes.
together, and I only give recommendation to join excellence only. And so we are together. We were doing the mocks like anything. And daily we were doing 5 6 mocks daily. And just I want to share the
Wow.
information. Today he gave the MRCS exam. Was his exam.
Today is
Okay,
the
okay. So
exam.
hope
Okay,
to
that's
have
great.
the good news from Dr. Hori Prasad soon.
Yeah, definitely. Based on whatever he has
And
told, I
definitely
think
we'll
he will pass.
arrange another session. Yes, definitely
Yeah,
we'll arrange another
definitely.
session with Dr. Hari. But
He
Dr.
has given
Hari
exam better
was
than me.
not that much.
As per his words, he has
uh,
given exam better than me. I missed a lot of things, but that was not the point. In the exam, I missed a lot of things, but they were checking for like how you are talking to the patient, how
Exactly.
much confident we are telling the answer, even if we are telling the wrong answer. But are you able to like identify what they are asking? They were like in pulmonary edema. I said pulmonary embolism. We got pulmonary edema, na? Applied science. I said
yes,
pulmonary embolism diagnosis, but he didn't say anything. He told, okay, justify how is pulmonary embolism. So I told she's having femur fracture. She was immobile for so long, so she may have. So he told, okay, acceptable, but just try to find other diagnosis also. So then I said pulmonary edema
differentials
later on,
basically.
like
Okay, there
differentials.
he asked.
Uh-huh.
Okay,
But on the first
basically
go, I was wrong.
regarding the basically regarding the critical care, I always keep saying in the classes, if you want to reach your diagnosis, you'll have to focus on the question because those questions are really larger, and you'll have to cover so many
Yeah.
things within 1 minute. And if you can cover the whole question, you can. It is really easier to reach your final diagnosis. Okay, Dr. Ankit, after attending the exam session, you had sent all the questions regarding your exam. Okay, now tell me regarding one thing, we always keep collecting all the questions, previous questions, especially from every single candidate. Like you told us, only 5 or 7% or 10% newer question came in the exam. Rest of the
Yeah.
are in your book. So
Yes.
always, what we are doing always, if after completion of every single exam, we do call the candidates and talk with them and collect all the questions from them, and we do very regular basis. We do update our book materials, and you'll be surprised. Within 6 or 7 months, we came to in the fourth edition of our book, and it's a rapid edition. Within six or
Okay.
7 months, we came into our fourth edition, and I think it is the most updated book in the MRCS OSCE field. So I would like to hear from your side. Did you follow any other materials other than our book, or you are getting that our book is enough to make you success, enough to make a candidate pass in the exam?
No, I think the book was sufficient. Though I have a habit of making my own notes, but yeah, the notes were made by your book and your
Classes.
classes, and I combined them all the information in one place, and then I read. This is my like I'm reading for since my started medical journey. I'm reading like this only. I collect all the information from wherever I can collect and put it in one register and read from there. So that in the end I can revise
Okay.
from there. I don't have to go here and there again and again. I
Yes,
can't.
yes.
I don't
While
have a
we
habit
do,
to read online. This laptop I cannot use. Well, since then,
okay.
people keep on using
Oh.
iPad. They keep on using, but I don't use iPad. I never use iPad. I use only register pen.
So
Register pen.
okay, that's great. So basically, we do discuss in the classes regarding every single topic. We go for some
Yeah.
background information before coming into the final diagnosis. We try to give you the in-depth knowledge so that you don't forget in the exam. Because if we want, we can do some shortcut in the classes. Like the first class was in the critical care was like esophageal varices. And this is only one station I take almost 1 hour 40 minutes to cover. And rest of the courses, if you consider with the rest of the courses, they cover 4 or 5 stations to cover only two within four. They cover 4 or 5 stations within 2 hours. But we took only to cover only one topic more than 1 hour and 40 minutes, just only to make you clear so that you don't forget in the classes. So I think
Exactly.
if you want to pass, after observing you from my side, if you want to pass the MRCS OSCE field in the very first shot, you'll have to give 3 things. At first, you'll have to make 6 minutes. You'll have to make yourself free for six months at least. So you'll have to
Yes.
focus for 6 months uninterrupted. The second thing, you'll have to attend in the live interactive classes in a very regular basis, as well as you'll have to attend in the mock session, and it is the key to make you success in the exam.
Yes.
And the lastly, all of the whole preparation, to complete your whole preparation is the simulation course like you have already done in the Dubai. So these are the three key points. If you focus these key points and if you can stick with these 3 points, that will be really easier to pass in the MRCS of the field. I think it's
Yes.
not a
Yes.
big deal if you have to
Yeah,
only
it's not a big
focus,
deal.
stick with this. Okay,
And
okay, Dr. Ankit. One thing I would like to is the last question from my side.
no, it's okay. It's okay.
Okay,
It's okay.
okay. So from my observation, I can see for the last 1 or 2 years in our country, especially in our country, the senior candidates are failing rather than the junior candidates, because senior candidates are always busy with their schedule, with their life, with their operations, with their teaching field, and all of these things. But they are very commonly doing so many large operations like triple bypass operation, gastrojejunistom, and so many operations. But in the MRCS OSCE field, they can perform the abscess drainage, even they can do the node suturing in a perfect way, and they are failing in the, especially in the skill portion. So what should be your advice as a senior candidate, because you passed in the very first attempt as a senior candidate or mid-level doctors like us in the first attempt? So what should be your advice? Why they are failing? I told you why they are failing, but what should be your advice for them?
Actually, the practice in our countries is different from what we have to do there. So first, they have to
Yes,
forget what they are doing in our country. So they have to
yes,
learn the ethics, how we have to do treat patient, how we talk to them. So that is the key. When in our countries we are doing like 1,000 INDs, doesn't matter. But that one IND which is perfect in every way. So we have to first unlearn those things and try to get the things. And you know what I was doing? And sometimes in the OPD itself, I am applying MRCS to my real patients. This I what did. Some of the patients from UK, from Russia, from Germany. So I used to apply the same MRCS concept in that, taking the history in 6 minutes for back pain, for knee pain. And then those patients were so happy ki they were telling no one has greeted us like this in our whole life in Dubai.
That's a good
But they
concept.
don't know, of course, what
okay,
I'm doing. But
really,
yeah, I like to, I did sometimes. And those patients were very happy from me in my OPD. They were very, very happy. So these things we have to do. We have to inculcate ourselves. It's not like that we have to ask for chevron because it is in the written the book. No, it should be inside me.
Yes,
okay,
Whether I will, whenever I do
yeah,
examination, I will ask. Kalas. Once we do this, then we'll once it's inculcated in my practice, then there is no you'll not lose your nerves there. Once it's inside me, this much you have to practice. This is what I can
yes.
say.
Okay, so yeah, I think the conclusion is same from your side as well as from my side. If you want to pass in the MRCS OSCE field,
But
if you are a senior candidate, then you will have to forget what you are at first. Just prepare yourself like the MRCS, the Royal College Surgeon is looking for. You'll have to practice by this way
yes,
and practice again and again, and after practicing again and again, that will be converted into reflex and ultimately passing the exam.
Yes, yes,
So I
yes.
think we have discussed enough. So, Dr. Ankit, what should be your advice for the newer candidates who are going to fill in the MRCS OSCE exam in recent diets? What should be your advice? And that is my last question from my side.
I just want to say only one thing. Keep on doing mocks, live mocks, friends mocks, wife mocks, with co-doctor, with whomsoever you want can do. Even in apply the same thing in your OPD. If you are seeing the patients, apply the same concept. Hello, I'm Dr. Ankit, one of surgical teams. I'm here to help you today. Can I ask what is the problem? Like that. You ask starting in OPD. Nobody's going to harm you. Nobody's going to say what are you doing, because it's a very good thing to do. So start doing. Get the things inculcated inside you. Once it's inside you, you don't have to fake it in the exam. And they know you are faking it or not. They know. They're very intelligent
Yes.
guys, examiner. They know you are faking it or you have inside you. So they know. So once it's inside you, then kalas. Do mocks, keep on doing mocks. This is my last advice. Mocks, mocks,
This is
mocks.
the key.
That's
This
it.
is the key. Mocks.
Yeah.
Yes, I also keep saying this. Mock,
And in applied
mocks.
science, I just want to say I did a lot of blunders in applied science in my pulmonary edema station. So read the concept. He didn't ask me direct questions. He asked very conceptual. He was asking very basic concepts. I was not able to answer initially. After 2-3 questions, I was able to answer. But initially, he was asking very basic concept. What is the effect of high blood pressure on heart, myocyte, like that? He was asking. I was very confused what he's asking. But suddenly, how to keep my nerves on? And I asked doctor, can I come back to this question later on? Like that, I did. And after 2-3 questions, I was able to answer. You have to, in applied
Okay,
science, you
that's
have
great.
to know the basics. Otherwise, you will lose it, because they'll ask basic questions
Okay.
sometimes. Hmm.
Okay,
Yeah,
that's
that's
why
the way.
we are not always stick with the book. Definitely, the books are the recall questions, most of the, and this is the combined bank of the questions. But behind the book, we do always practice, we do always try to give you some basic concepts so that all the scenario can be very easier for you. So I think we have done with all of our questions, Dr. Ankit. Thank you very much, very much. You
Yeah,
wanted to
yeah,
come in
sure.
your country, but under this condition, you couldn't join in the mock simulation course. But still, I am inviting you come visit in our country, and definitely
Yeah, yeah, I will try. I will try
we'll have some
definitely. Definitely, I'll try.
with your
Okay, okay.
family and with your 2 kids, and
Yeah, yeah, yeah,
we
sure. I
have
will try.
fun together. No problem.
Definitely,
So, Dr.
definitely.
Hassan,
Okay.
do you want to ask any more questions?
No. But I just want to share one thing that I got to know one information that you can practice your history taking and clinical examination in your OPD. That's what I can actually share with our future aspirants. That is one of
Yes.
the ways that can be, but that was very unique. But in our setting, that may be quite difficult, but that is very much possible in OPD, if I'm not sure. And that is a very good thing and very good way to practice yourself and just keep the concepts within inside yourself. Just don't think about that you are reading books and you have to act. Don't look like this, because you are a physician, and grab those concepts inside yourself. That would be the key to
Yes.
success. And another key to success is, yes, attending the mock session. That is what we got to know from Dr. Ankit, and he has just mentioned again and again. Okay, but last but not the least, we are thanking Dr. Ankit despite of his so
I will
much.
also like to
Yes.
share my gratitude to helping me to pass my MRCS, because I was very keen to pass in first attempt.
Okay. Thank you. Thank
That's
you.
great.
Okay,
Thank you,
okay, okay.
Dr. Ankit. Thank you. Good night.
Thank you.
Thank
Bye.
you.
Good night.